Welcome back. May marks Maternal Health Month. It means to bring awareness to a critical and often overlooked part of maternal care. Maternal mental health conditions, including postpartum depression and anxiety, affect 1 in 5 women, yet go undiagnosed and untreated. Access to mental health care before, during, and after pregnancy in underserved communities remains inconsistent. Joining me now with more on this very important issue is Dr. Janelle Bolden. She is an associate professor of OBGYN at Northwestern Medicine. Thank you so much, doctor, for joining us.
Thank you.
All right, let's get right into it. Can we talk about Maternal Health Month and why is it so important? What is it that you want women and their families to understand?
Absolutely. Thank you so much for having me here. As you said, May is Maternal Mental Health Month, and it's important because mental health is a really critical part of health in general and pregnancy health. We know that mental health conditions can be really common in the pregnancy and postpartum period, and it's one of the leading causes of pregnancy-related death. But a lot of these patients aren't getting the care they need or the care they deserve. So access and awareness to this issue is really important.
It doesn't feel like it's talked about enough, does it, doctor?
Agree. Especially, again, being one of the most leading causes of pregnancy-related death. This is something that should be on everyone's radar.
Now, and on that note, can we talk about what are the most common conditions that you're seeing and how and why is it, again, like you say they go untreated? What is the reason behind that?
Right. So postpartum depression and anxiety, I think, are the most common conditions that we see. However, in that postpartum period, you know, it can be really chaotic, really complex, really confusing for a lot of patients and their families. And so I think there's a lot of shame and embarrassment that comes with acknowledging these feelings. And sometimes even when patients bring up these questions or concerns to their doctors, sometimes it gets overlooked, sometimes it gets diminished, and so then patients say, well, maybe this is normal, maybe this is the way I'm supposed to be feeling, and so there's a lot of confusions. And so we need to, and by we I mean physicians and healthcare providers, we need to listen to our patients, and we need to make that environment safe and welcoming so patients can come in and talk to us and feel heard.
And I was speaking about that for the postpartum care. Like I mean, I'm a mother of 2. You see your OBGYN up until a certain point, and then it drops off.
Yes.
And that seems like a very critical time.
You're so right. Yeah, absolutely. So sometimes patients will come in for their 6-week postpartum visit, and then that's all. There's legislation that is advocating for that postpartum period to be a year, right? And so that we can still have that touch points with patients and also more frequent touch points. So not just a 6-week visit, but hey, I'm going to call you at 2 weeks to make sure you're okay. Hey, family members, check in on this mom. Don't just let her languish there by herself. Let's make sure she's doing okay. Let's ask the questions.
Now, here's a very important question. Can you briefly touch on maternal mental health challenges that are more pronounced for women of color?
So it's going to be the same challenges. However, when you layer on structural and systemic racism on top of all this to begin with, it just makes it so much more difficult. And medical mistrust is really common among communities of women of color. Sometimes we don't even want to go in to see a healthcare provider because we're worried that we're not going to get the care that we so importantly deserve and need. So that is a huge barrier that we still must try to overcome.
And just lastly, I know you're a board member of Friends of Prentice. How is this organization helping to advance research and all of to better support mental health outcomes for women and families?
Thank you for that question. Yes, Friends of Prentice is an organization that encourages, supports, and most of all, funds this important research. We need research that thinks about what the patient needs from the patient perspective. And so we need some innovative research in that way so we can get to the right solutions and the right interventions for all patients.
Well, thank you, doctor, for joining us on this very important topic. Now, if you want more information about Maternal Mental Health Month on our news app, go to our website, ABC7Chicago.com. We'll be right back.